It's well known that our city is currently facing an opioid crisis. In 2016, the number of overdose deaths began to spike. That year saw 232 overdose deaths, which was a 67% increase from the previous year. In 2019, that number skyrocketed to 394 deaths, which represented a 183% increase from 2015. As we likely all know by now, the problem is largely due to the increased presence of fentanyl and carfentanil in Vancouver's illegal drug supply. So how do we address this crisis in our city? Although naloxone kits and overdose prevention sites have helped decrease the number of overdose deaths in our city, the DVBIA believes that a safe drug supply is what's needed now to truly make a difference. We have long been supporters of the 4 Pillars drug strategy, which is based on the principles of harm reduction, prevention, treatment, and enforcement. But it's time to include a safe drug supply in the mix. Our board of directors recently approved a policy for the DVBIA to call on the federal government to expand access to safe supply by proactively supporting all doctors, health authorities, and provinces across Canada to safely provide regulated opioids through a free and federally available pharmacare program. This is a national public health emergency, and indeed a problem faced by many large cities throughout the world. What's needed now is for us to allow cities to implement innovative pilot programs that prioritize diversion to safe supply. This could be a means to address the growing opioid crisis in our city. The DVBA supports this and any other measures that can help prevent overdose deaths in the short term as we continue to work towards long-term solutions.